My role here at the Mission is Director of Program Support Services, which supports the crisis program and the recovery program, such as the food service, the Hope Clinic, and the work center. When the pandemic hit, we had to really up our sanitation processes in every department in order to keep the people that were inside the house safe, as well as we had to mask up, gown up, everything else when they would see patients here in the clinic. Plus then we had to be really cautious of the people that went home, because truly the people inside the Mission were not the ones who were getting COVID. It was the staff who could still go to the grocery store were getting COVID and bringing it back in. You know, Jennifer was going up to the floors and seeing the really sick people every single day or twice a day to make sure that they didn't need hospitalization. Some things I really loved about the pandemic is the way the residents in our recovery program pulled together when they were shut down for the 7th, 8th time, because every time they were shut down, it was for 2 weeks. And that can be a long stint with being in your house for that time. And then the people that had to go in quarantine, they really got a lot of care from the other residents that were up there. So I think we pulled together as a family. The Mercy Health doctors do see patients. We have 2 volunteer doctors who come in and see patients and get them their bridge prescriptions that they need if they've been off their medications for whatever reason. And so then we can point them to a primary care physician. We have a great number of volunteers here at the clinic. Chiropractors come in weekly to see our patients. We have dental hygienists and dentists, which is great because some people have gone years and years without having a teeth cleaning. People who have been out there living on the streets or in their addiction haven't taken care of themselves. It is so important to be able to welcome people in and get them the kind of care that they need, and our nurse Jen will push and push so they get the good quality care that they should be getting. There's really specific needs that they have, and Jen does a great job of tending to that. We had one gentleman who came in, he had a burn and didn't have any place to get the burn dressing changed. So for months, our nurse Jen changed the dressing for him and took care of him. He wasn't gonna go through recovery, he wasn't gonna do it. Well, because of her love and the care that he received here, he went through the program. He's living a good, solid life now, which is just absolutely amazing.